The PPPC government ascended to office in August of 2020, 5 months into the COVID-19 pandemic, and at a time when the country was basically shut down by the previous government. The pandemic was a major challenge that affected all sectors, particularly the health sector. The way the country moved forward depended on how the pandemic was handled. The PPPC government wasted no time in taking control of the situation by implementing several measures, including the provision of adequate personal protective equipment, building testing capacity, and outfitting the infectious diseases hospital at Liliendaal with the necessary equipment to function in that capacity. When a COVID-19 vaccine was discovered, the government was quick to secure vaccines for the population. And so far, approximately 444,000 adults have been vaccinated with a first dose, while 343,000 have been vaccinated with both doses. Government also secured vaccines for adolescents aged 12 to 17, and more recently in June 2022, Pfizer vaccines for children aged 5 to 11 began rolling out in Guyana. Government also began working with several developmental partners and international universities in building its laboratory capacity and training for healthcare workers fighting the COVID-19 pandemic. During the first year in office, while managing the pandemic was paramount, other initiatives, such as outreaches to hinterland communities, also provided a way to take healthcare services across the country. Towards its development, the health sector received a boost of $73.2 billion in the 2022 national budget. In this feature, Minister of Health, Dr. Frank Anthony, highlighted several plans and initiatives that will see the sector modernized and completely transformed over time, with major focus on primary health care.
We have different layers in the health sector. So if you think about the community, we have health posts, especially in very rural communities, because they're so far away, you need to have some health presence in these communities. We also have health centers. That's the next level. We have district hospitals, regional hospitals, and then of course our referral hospital. So a lot of our primary healthcare work is done by the health posts, the health centers. To some extent, we have also a lot of primary care work being done at district hospitals and at our regional hospitals, especially with our outpatient clinics.
The ministry over the last few months has been working with the Pan American Health Organization, PAHO, to develop a comprehensive package of healthcare services by levels of care.
We keep expanding the amount of services we can give and the quality of that service and so forth. We have come up so far with 215 different interventions that would be at the most basic level. So now that we have identified this, we've started a process where we have now be training our healthcare workers to be able to accommodate this change.
The government, through the Ministry of Health, is looking at innovative ways in which healthcare delivery can be revolutionized, ways in which those in remote or far-flung areas can receive the same level of care as persons on the coast. One way is through telemedicine. According to research, telehealth or telemedicine is a distribution of health-related services and information via telecommunication technologies. It allows long-distance patient and clinician contact, care, advice, reminders, education, intervention, monitoring, and remote admissions. Telemedicine is sometimes used in a more limited sense to describe remote clinical services such as diagnosis and monitoring. When rural settings lack transport, mobility, conditions due to outbreaks, epidemics or pandemics, decreased funding, or a lack of staff restrict access to care, telemedicine may bridge the gap.
We'll, of course, provide the internet connectivity, so if they have phone services, that's going to be very easy. We can utilize the existing service. If they don't, we'll have to put in a satellite connection where we can connect the health center. Now that healthcare worker will be trained to use a special laptop computer that would have an EMR system, an electronic medical record system. So when the patient comes in, they're able to talk to the patient, record the patient's details, their name and age and the patient's history and so forth. And then an interesting thing happens. The community health worker is then able to dial up a doctor that can be in Georgetown or in any part of the country. They dial up that doctor then would see the patient on screen and then conduct an interview. And if there's a need to do any specialized tests, so for example, the doctor would like to hear the heartbeat of the patient, so he would then instruct the community health worker to put the stethoscope at the appropriate places on the patient, and he would be able to hear the sound 400, 500 miles away. Because with the laptop, we'll have a set of tools, so stethoscopes, cameras, ultrasound, and so forth, that would all be connected to this laptop. So these are a set of internet-enabled devices. So we'll be able to listen to the sounds, see images, as if the patient is before you. And I think that would help to change how we do medicine tremendously.
Dr. Anthony, while noting the transformational nature of this project, said it would have to be rolled out in a phased manner. Citizens can also look forward to improved facilities at their respective health posts and clinics in the 10 administrative regions.
If someone comes to any one of the facility and they have to wait a little bit, they would be able to do so in relative comfort. And this is one of the things that we're rolling out right now. We piloted this last year in Region 6, and we've been able to repair most of those health centers in Region 6 last year. And it worked extremely well. Patients have less complaints now, and we are very pleased about that. So because of the good experience that we've had in Region 6, we are now rolling it out in every other region of the country.
Government is wasting no time in getting this transformational project off the ground. Approximately $1 billion has been set aside to facilitate these upgrades. Guyana is benefiting from the smart healthcare facilities in the Caribbean project, which is being funded by the United Kingdom Department for International Development at a cost of $835 million. Under this project, 5 institutions were identified for upgrading: Diamond, Lenora, Mabaruma, Lethem, and 𝐎𝐅𝐅𝐈𝐂𝐄 hospitals. The Diamond and Lethem hospitals have already been upgraded to smart facilities. The smart hospital concept refers to a health facility which provides standard and efficient healthcare while at the same time being climate resilient.
It is important that we prevent flooding, so we have to raise the base of the facility. We have to make sure that you can have better flow in the facility. We have reconfigured these facilities to offer that kind of better flow, and also to use things like rainwater back in the facility. We have also repurposed these facilities to use a lot of solar power to reduce our dependency on the national grid.
The gasseting of the Mabaruma Regional Hospital as a smart hospital. In Region 1, we now have operating theatres at KDH, and which is 𝐘𝐄𝐀 District Hospital, and Port Kaituma District Hospital, X-ray services, and other primary health care services that the people were longing for, where they had to go to other places like Anna Regina and Suddy and so forth for those services are now being offered right in Region 1 to the people. So for me, that is development.
Apart from the smart hospitals, the government has committed in doing major upgrades to existing hospitals and facilities. The Diamond Diagnostic Center, West 𝐎𝐅𝐅𝐈𝐂𝐄 Regional Hospital, Bartica Regional Hospital, and the Suddy Hospital will all receive major upgrades.
These hospitals, we're thinking about, we need at least 4 to 5 acres of land to put the hospital and to make sure that we have all the amenities there. We want to have a modern lab in each one of these facilities. We want to have modern imaging facilities. So if somebody come in, they need to have X-ray, it should be digital. They need to do a CAT scan, that should be available. If you need to do an ultrasound or an echo, these things should be available.
6 new regional hospitals will change the landscape of healthcare in several regions across the country and will complement these existing facilities.
The quality of healthcare that we deliver at this level would vastly improve, and people would have ready accessibility to getting this type of service. We are going to do a lot more work on Georgetown Hospital. We are going to be upgrading New Amsterdam Hospital and the Linden Hospital. So that's another wave of infrastructure works that we'll be doing at these facilities.
The finishing touches are also being placed on a new diabetic center at Lusignan on the east coast of Demerara, while preparations are being made for the construction of a modern pediatric and maternal hospital at Ogle on the east coast of Demerara. In addition, millions of dollars were given to several persons across the country to upgrade healthcare centers. With all of these infrastructural developments, the ministry has also seen the need for training of more nursing and medical staff and is aggressively pursuing training opportunities, which includes working with the World Health Organization's Collaboration Center in Brazil.
We have engaged them, and they are right now designing a hybrid program for Guyana for registered nursing. Right? In another 2 to 3 months, we want to have that program up and running. And at the minimum, once that program is up and running, we want to start training at the minimum about 500 persons using this hybrid method of online. And then you come into special simulation centers that we will develop so that you can get practical training. We are also going to look at doing a lot of specialty courses, because depending on the needs, whether it's in surgery, obs and gynae, critical care nursing, ICU nursing, so all these tracks we will be looking at. And again, the support of the council will be very vital as we move this process forward.
The Health Ministry in 2022 continued a series of medical outreaches that target far-flung areas in the country, especially hinterland communities. These medical outreaches take specialized services to residents in dentistry, ophthalmology, obstetrics and gynecology, among other services.
It is the mandate of His Excellency President Irfanali that we take healthcare to the people. He spoke about equal and equitable access to healthcare, and we know that persons in these areas, it's more difficult. The highest level of care in this area is a health center. Of course, we have a doctor who's based here.
I'm really glad that the doctor come to Separuta and to do this VIH, and I'm so glad because there's so much money for go out. Go do it.
I really feel happy about this because in our community there are a lot of women. The first thing when we notice that they are having this sickness, right? So and them they're bad, and some of them are die with it. So I'm so happy today, and I'm proud that this doctor come and they could do this test for us. And I also do it because I'm happy to make sure that our body is safe and perfect health.
In its bid to modernize the health sector, the government of Guyana has also set out to introduce new bills to the National Assembly and update existing laws to govern the health sector. Late 2021, the transplant bill was passed in the National Assembly. This bill provides the legal framework for the removal of human organs, tissues, cells, and biofluids for transplantation and blood transfusion.
While we have transfused blood for several decades, and we have been transplanting kidneys since 2008, and we have been transplanting corneas since 2014, there has been no legal framework in place to regulate the donation of blood, organs, cells, or tissues. This legislation is now going to put that framework in place so that this can be done ethically and safely and in keeping with the global best practices.
Other bills that are before the National Assembly are the Mental Health Bill and the Radiation Bill. In Guyana, radiation is used for imaging such as X-rays and CT scans or treatments of cancer. But currently, there is no law governing its use here.
What this bill seeks to do for the first time in our country, to be able to establish international norms and adopt them as national norms for Guyana in terms of how we do imaging and how we do these processes to treat cancer. And I think it's important if we are going to develop cancer treatments in the country, we need to have the legislative framework.
As health officials continue to battle the COVID-19 pandemic, Guyana is one of the first countries in the region to secure specially formulated Pfizer vaccines for children between the ages of 5 to 11. This was welcomed by parents who took advantage of the opportunity to get their children vaccinated.
A relief. After so long, I think it's good that the children are actually vaccinated now. Being a teacher and all, we see children getting sick in school, like not many, but a few. But, you know, they're all excited to go back to school, and then with the learning loss and everything, it's good that they're actually giving them now.
I have 3 children, ages 6, 9, and 11. 2 of them are already going face-to-face school, and I think it's very important as we return to our classrooms and try to bring back a sense of normalcy that we get our kids vaccinated against it. We've had like pockets of outbreaks in schools and so forth, so for me, I feel that once we can protect them with the vaccine, we have a little bit more sense of, you know, a relaxed sense than just sending them out.
As the PPPC government observes 2 years in taking office, improvements in the healthcare sector continue to be evident across the country. And while some projects have not yet been completed, the population has a lot more to look forward to in the coming year.